Okay, Ashley, do you want to let's go ahead and get started?
Sure. I was just going to say that. Okay. Well, thank you everyone who has come in today. We'll be hearing from Judge Goff today on how to engage resources in assisted outpatient treatment, otherwise known as AOT. Brief disclaimer, the views, opinions, and content expressed in this presentation do not necessarily reflect the views, opinions, or policies of the Center for Mental Health Services, the Substance Abuse and Mental Health Services Administration, or the U.S. Department of Health and Human Services. And a couple of reminders about noise control. Please keep your phones on mute if you're not taking part in the discussion, but please do not put your phones on hold. And lastly, this webinar will be recorded so that we'll send it out to you from after the webinar is completed. And with that, I will send it over to Judge Goff. Thank you.
Thank you very much. Well, good afternoon. This is Steve Goss. I am a state circuit judge in Albany, Georgia, and very southwest Georgia. I have been, among other things, presiding in our co-occurring disorders mental health substance abuse treatment court program since 2002. Ashley?
Yes, I can hear you, but I'm going to send a text over to Kevin.
Okay. All right. Let me do this. Let me try to reconnect. Okay. Just
okay.
Hold, please. All right, this is Steve Goss again. I think we had a little bit of audio difficulties. I hope I'm able to be heard now. Ashley, can you hear me?
Yep, I can hear you.
Okay, I think we're good now. Again, sorry for the technical difficulties. As I was saying, I'm Steve Goss. I'm a state circuit judge in Albany, Georgia, and very south Georgia. I have presided over our co-occurring mental health and substance abuse treatment court program for 16 years. But as an adjunct of that, through the years, we developed a competency restoration docket, and part of that has been my work in trying to develop within our community assisted outpatient treatment provisions for some of our participants who were not restorable to competency, yet did not meet inpatient civil commitment criteria. They were neither an imminent danger to self or others. And so that's been my experience in working with AOT, and I hope to be able to share some thoughts with you today on how to engage and develop resources in a community. This first slide, I always like to sort of go back to the old court case analysis of things about who, what, where, and when, or who, what, where, and why, I guess, in this instance. I always say, you know, every community has its own strengths and its weaknesses and its own resources and its own resource challenges. And so everything has to start at the local level. which is really the nature many times of these AOT type programs. It's trying to identify a need within your community or your jurisdiction, and then trying to put together and marshal and effectively utilize the services within your community. The first who to reach out to, I believe, is always going to be the judges and any other team members and allies. Try to figure out who in your community hasn't, dealing with these issues. Who, whether it's emergency room personnel that are dealing with some of these people within the community who are in repetitive states of crisis and decompensation, whether it's the legal system, be it the circuit judge or the probate judge or the chancery judge, depending on what your jurisdiction refers to those judges as by their title or nomenclature. Obviously, the treatment community, whether it's your community services board clinic or other behavioral health clinic within your community. And then obviously try to bring in or partner with representatives from your state hospital system that work your area of the state, and try to figure out what's available. I think many in a court perspective, we are unaware of what's available in a community or in an area of the state from a behavioral health standpoint, and there's a reason for that. There's probably not two professions that from the very beginning of the first day of either medical school or law school that it is sort of put into our professional DNA about the issues of privacy and confidentiality of patients and clients. And so historically, people in the clinical world, be it physicians or nurses or psychologists or nurse practitioners, and in the legal world, be it judges and attorneys, we're not used to talking to each other very much, and certainly not about individual cases. But we don't have very good lines of communication many times. So many times there are some resources in a community, even if it's a rural community, that can be utilized to form the basis of a AOT program if simply court personnel are made aware of them. The second bullet point on this slide, we talk about what are the kind of resources. It's not always money. Now, obviously, in most jurisdictions across the country, we're always struggling for trying to put together financial resources to hire personnel and to sustain programs. But many times, particularly in rural America, it's human resources. It's having clinical availability. You may be many miles or more than an hour's drive away from the nearest board-certified psychiatrist. So a challenge in a smaller community many times is to try to establish, what resources can you practically tap into clinically in a community, whether it's a nurse practitioner, whether it's a family practice practitioner, maybe it's personnel at your local community hospital. The where bullet point, again, I think it has to be a mixture of state and federal partners, but the reality of it is in an AOT program, many times it is very much on the ground at the local and community level. And then finally, why? It's the old analysis of why would a person, maybe a judge, maybe an attorney in the local court system, why would you want to become a champion for these programs? Well, first, we want to stabilize these folks that are struggling within our communities with behavioral health issues, many times that are self-medicating with street drugs or alcohol. We want to avoid the health crisis episodes, which land many of them either in jail or in an emergency room or in an expensive crisis unit bed and many times from the judge's standpoint, they end up in court, whether it's on the civil side, maybe a loved one seeking a guardianship or conservatorship, or in a criminal case. So let's go to the next slide. I would also say, if anyone's on the call, if you've got any questions, we have the availability for the chat. I may not be good enough to respond to your text message, but if you will put a question or a comment, I will try to address it as we go for a more meaningful dialogue here today. And Ashley, just to make sure, because of our technology, are you still able to hear me on your end?
I sure can.
Okay, thank you very much.
Yep.
All right. I'm a judge. I've been a judge, and I hope to continue being a judge. So I'll give you the disclaimer. I'm going to talk a good bit about judges in this segment today. And I know that I have, in talking with mental health advocates around the country and communities, be it with NAMI or loved ones or friends and family, or be it just an advocate in a community, many times they express to me, if I just knew how to get a judge involved in our efforts in a community, how to do that. Well, the first thing I will say, like in life, different people have different personalities, whether it's judges, whether it's lawyers, whether it's school teachers, bankers, whatever walk of life. Some people are, tend to be more reserved than others. Some people are more approachable than others. That disclaimer given, I think across the country, judges are people who are public servants. They are where they are in some measure because they want to do good things in their community. They want to serve the public. And so I think many times if you're an advocate or a clinician that wants to engage a judge in conversations about these type of programs or the potential for these type of programs, sometimes you have to just ask, because most judges are certainly willing to talk to people in their community about community issues, because the reality of it is we see so much. We are the source, or we are the location where people end up with civil and criminal disputes. Many times the judges are called upon, in whatever setting it may be, to make decisions that other people will not, cannot, or do not make for themselves. And so judges are very, very interested in what's going on in their communities, what the perceived issues are, and also exploring what are better ways to handle certain issues, because most judges are very busy. They have crowded dockets, and so that anything that we can do to remedy issues or to assist remedying issues that avoid litigation and avoid people ending up in court, most judges are always going to be willing to talk about such things. I do think that an AOT program obviously is a court-annexed program. Typically in a civil setting. It could be in probate court, it could be in a county level court, or it could be in a court of chancery, depending on the nomenclature of a particular state. One thing when we're talking about developing resources is to say, okay, we've already got some semblance of an AOT program in our community. Then, Judge, how might we get referrals from other judges or other courts within our court system? One thing I think is always important is to never assume people know about your program. You might have started your AOT program 18 months ago or 2 years ago. Personnel change. The attorneys who routinely appear in court, particularly the younger attorneys. Faces may have changed, and information may not have been passed along from an experienced colleague to a new colleague coming on board. So I think it's always important to periodically, if you already have an AOT program, is to try to do a little outreach, particularly within your legal community. And that may be something as simple as the judge sending out an email to his or her colleagues on the bench to tell them about the program. It may be, an intermediate step that I think is many times helpful is to let the judge call together a meeting, and we'll talk about that on the next slide. But just in general, whether you're coming from a standpoint of a clinician's background or a lawyer's background or a judge's background, don't assume that everybody in your community knows you've got an assisted outpatient treatment program put together. You've got to share the word, and you got to put the word out if you're going to try to increase your referrals. I think another topic to always be thinking about when you're trying to expand your program or possibly develop a judicial succession plan. If you've had a judge who's been a real advocate for persons in your community, programming for persons in your community struggling with these behavioral health and or co-occurring alcohol and substance issues, think of it in terms of who's the next person to step up going to be. If that judge retires, if that judge rotates off this particular assignment, who is the next person to step into the void there? And I always like to use the acronym WIIFM, which stands for What's in It for Me. We as human beings, we go through that sort of quick risk rewards analysis in our mind multiple times a day for multiple different things. We always need to think about, whether you're a clinician, whether you're a community advocate, a lawyer, a judge, is why would I want to be involved in this program? What about having an AOT program thriving in our community is going to benefit someone in my role? Is it going to be to improve public safety? Is it going to help stabilize fragile people? Is it going to be to unclog crowded dockets? If you're trying to sell the program to another professional, always think about those issues. Even if your program is more of a diversion program with less judge or judicial officer involvement, and these programs, even within this particular AOT project we've been working with, there are some in urban centers and some in very rural areas, and there are some with different models. But even if you have a program that's more of a diversion-based program with less judicial intervention, always try to link back to the court in whatever way you can, because my experience has been that in smaller communities and in rural communities where people know each other, many times that court touch point, that court pivot point in a community is important for building momentum. If it is perceived in the community that the judge says at the Rotary Club or at the other civic club where he or she's given a lunch and talk that this is a program that the community really needs to support, that carries weight a lot of times. So don't lose sight of that when you're trying to develop resources. Let's go to the next slide. I always refer to it as a HUN meeting. And given the technology we're using today with a PowerPoint slide, that's sort of the giveaway. Any judge, I always tell them, what's your first name? And they'll always tell me their first given name. And I said, no, what's the first thing in front of your name when you sign a letter or on an envelope? And it's HON, short for honorable. And I call that a HUN meeting. Now, I'm not blind enough to think that just because I'm a judge and I say it, everybody's going to jump up and down and think it's a great idea. But typically, if the judge sends out an email or the judge sends out an invitation in writing or the judge makes a few phone calls and says, we need to get a group of people together to talk about the need for an AOT program or the need to expand our AOT program, typically people will respond. So I think if you've got a judge who is working with you and you can get them to say, look, Judge, it would really help if you would call a community meeting to call some of our stakeholders together. That would be very, very helpful because, again, as I alluded to just a few moments ago, even if your AOT program is not completely seated within an existing court, your probate court or your county court, that's still a point in a community where energy, synergy, and momentum can be developed. The judge calling it together many times cuts through boundaries and turf, and it also goes back to what I mentioned earlier. Historically, clinical professionals keep information in silos, legal professionals keep information in silos, and we're not very good at talking to each other. And so if the judge can convene a meeting where a representative of the local hospital's emergency room comes and a representative of the community's behavioral health and addictive disease clinic comes, and maybe community advocates, that is a good way of alerting people in the court system, the lawyers and the judge, what resources may be in the community that have never been put together in a coordinated fashion. And it's, as I mentioned here, it's not just that the left hand doesn't know what the right hand is doing. Sometimes the left hand doesn't realize there is a right hand. So the judge calling a meeting together and getting some of these interested stakeholders around the conference room table many times helps break down barriers and lets a community address an issue and figure out how you can best marshal your existing resources. Let's go to the next slide. If you have a judicially hosted meeting, as I just alluded to, you don't want the meeting to become so big that it just becomes sort of what I like to refer to as a moan and groan session, where everybody just sort of comes in and tells about what a problem they're having, or their jail's overcrowded with people with behavioral health issues, or there are too many people standing in line in the emergency center, etc. What I think you need to do is to try to identify who are the major stakeholders, who are people that really have an interest in this in a community, and then to try to get somebody, and preferably somebody with decision-making authority from each agency, and that doesn't just have to be government. It could be, figuring out who's your local nonprofit, et cetera, that you might tap into some resources. I always think in any community, particularly in a non-urban setting, the sheriff in most of America is one of, if not the most recognizable government official in a community. They know everybody. Everybody knows them. They typically know everybody's family for multiple generations. They are very, very connected to what's going on in their community. They hear a lot of things. They're getting reports back from their deputies who are on the ground and on the road and working within the community. So even though AOT is civil in nature and it's not a criminal case-based program, the sheriff, maybe the chief jailer or jail staff, always great to have in the conversation, because if you can frame this in a community that this AOT program would really help and that the sheriff is supportive of it, that carries a lot of weight with public opinion within your community to get support for your program. Likewise, even though I know many of our programs do really have strong crisis intervention training, CIT team training in their law enforcement, that is always a great resource. If you can get your police chief or someone from local law enforcement to initiate, if you don't have it, or to expand CIT training for officers, that is a quantum step forward, even in a tiny rural community. Again, all across America, most states are downsizing with state hospital closings and state hospital staffings. So you may be in a rural jurisdiction that may be 150 or more miles away from your closest state hospital, and you may say to yourself, I'm so far away that from a practical standpoint, this doesn't help me locally on a day-to-day basis. I would urge you to reach out to people in your general medical community. If your community has a small general hospital, you likely have an emergency room, and this emergency room personnel, they're seeing these persons coming in decompensated in acute crisis. They're very interested in these programs because they're trying to work with these patients in a more coordinated fashion. And many times that medical staff will be aware of possible programming and resources that court staff is not going to be aware of. And in that same vein, of course, reach out to community crisis center or community behavioral health center and state hospital personnel, because many times they may be aware of some programming that can be delivered from the state level. We've had a few folks join us as this has been going on, and I would again state you have the chat box available. If you want to post any questions, I will try to address your comments or questions as we go forward, or if you want to reserve to the end, that's fine too. Who to invite? We've talked about government officials. Think broader than that. Think about asking local attorneys, and sure, if your state's attorney or your district attorney is willing to become involved, that's wonderful. Sort of like the sheriff, that person is viewed favorably in a community. They're elected. They're respected by people in a jurisdiction. And if they come forward and say, we're dealing with a problem here, we need your community support for an AOT program, that carries a lot of weight in public opinion. But also look to other attorneys. Look for people who frequently work and practice in your probate court, who serve as guardian ad litem's many times, because most of those folks know the challenges being faced by persons in your jurisdiction with behavioral health and addictive disease issues, and they can be real advocates in your community also. Reach out to NAMI or family or friends or peers. I know many times we work really hard, whether we're judges or whether we're clinicians or whether we're probation officers or lawyers, and we have a lot of collective experience working on these cases, but we sometimes, and we don't intend to, but we overlook the people with lived experience. And so we really need to involve peers and NAMI and family members who have that firsthand day-to-day experience with these issues, because they have great insight into what the needs are in the community and how certain challenges may be addressed. Reach out to your social services providers, and don't overlook your nonprofits in your community. Salvation Army, Goodwill, not only for housing, but many times Goodwill, for example, they will have some employability opportunities and some job training opportunities for your participants. So think outside the box in that regard when you're trying to build a community coalition. Reach out to the faith, community, and civic groups. Now, for those of us who are judges, we understand what the First Amendment says about separation of church and state. I think we're always very cautious about that because we don't want to ever be in a position of, as a state judge, mandating somebody go to a particular faith-based program. We avoid that for Establishment Clause reasons. However, I don't think there's anything at all wrong with reaching out to the churches in a community. Many times they can assist with resources such as sometimes they'll have a church van that they'll be willing, church members might be willing to do some limited transportation for your program. They might, for example, you may have a women's group within a church, Sunday school class or otherwise, who may be willing to assist your personnel in putting together clothing or weather-appropriate clothing for people that are in your AOT program, particularly if you're in a part of the country that has severe weather in the winter months and people without adequate coats and jackets and warm clothing. That many times is a real practical way to engage people in the community to assist. Let's go to the next slide. It's always a fine balance. Trying to strike that balance, hit the sweet spot between the need for trying to put together a community coalition or a court structure balance versus we're all busy and having meeting after meeting after meeting and people burn out on that. So you want to have the meeting, you want to get the judge involved, you want hopefully to encourage the judge to convene the meeting and to be a change agent. But at the same time, a lot of this resource development may come in later follow-up meetings with smaller groups of people focused on particular issues. Let's go to the next slide. Depending on where you are and what the judge's role may be, or judge's other docket, or judge's other responsibilities, if you're in a rural community, your judge may literally ride the circuit. So your judge may not be in your particular town every day of the week. They may be in the adjacent county several days a week. But I do think this. I think the more judicial involvement you can have in your AOT program, it's beneficial not only for community support, but it also provides a little more framework of structure for your program. The reality of it is many of our participants in these AOT programs, due to their health and other psychosocial factors, have lived rather chaotic lives. They've been sort of bouncing about because of lack of stable housing. They're having these acute episodic decompensation episodes where they're in and out of jail, in and out of the emergency room, in and out of crisis. So I think anything we can do to build a little bit of familiarity and structure to their day or their week is always beneficial. If your judge can carve out the time on his or her schedule to periodically hold a status report date on these AOT participants, it is helpful. Now, I recognize you may have to balance that against transportation constraints and court schedule. But what that does, it allows the court team members to be focused on where their participants stand. It allows everybody to gather together briefly to see if things are working well, if things are not working well, what needs to be changed or modified. And so for the team members, there's a little bit of structure advantage and some accountability. And it cannot be overlooked. And I recognize these programs are civil in nature and they're not criminal court based like a drug court or a mental health court program. But we've learned a lot through the years in research in these treatment court programs on the criminal court side, that doing exit interviews with thousands of graduates, that typically participants say that the most important thing to them was the relationship and the trust and the rapport that they built with the judge over time. The judge is a person in a position of authority who's taken the time to get to know them, to talk to them in a meaningful way on a periodic basis as they come into court. And the person gets, the participant becomes engaged. So if you can develop a little of that in your AOT program for the judge to be involved, I think that is always helpful. With that, we've got about 15 minutes. I'm willing to take any questions or any comments, but I strongly urge all of you, no matter what your role is, to really continue to foster relationships. Try to engage your judge as much as you can, because he or she has the ability many times to provide some structure to your program, some structure to your participants going through your program, but also to help you span some turf areas and develop resources within your community. So any questions or comments?
Okay. Well, we certainly, if you have any questions, I can send them over to Judge Goff myself, or you can certainly send them to him. His contact information will be on the slide shortly after this. I just wanted to say a brief reminder that anyone who would like to set up a one-on-one office hour with Judge Goff, you are free to contact me. My information is down at the bottom. My name is Amelia. I'm just taking over for Ashley until October. So you're welcome to do that, and I will schedule that with Judge Goff if you would like to do that. And lastly, we'd just like to say thank you for attending. This webinar was recorded, so I will be sending out the full webinar to everyone who is on this list. But again, if you have any questions, please feel free to let us know. We do have some time, so we can stay here for a little bit. Otherwise, you can let me know, and I can inform Judge Goff and get those questions answered. If not, then I just want to say thank you again for everyone who was able to attend. I'd like to thank Judge Goff for speaking today, and you should receive this webinar in not too long after this. So thank you very much.
And Amelia, let me thank you. I probably, out of pure oversight and habit, called you, because I'm so used to calling Ashley's name, but you have.
Sure.
You graciously stepped into the void here as she's out on leave for a few weeks, and if I did so, it was inadvertent. Thank you so much for your help.